Greetings, friends. Some sweets and some treats on this fine April evening. So just put together a little bit of silliness to hopefully throw a little light on the history of compassion circles and more broadly the story of closing the compassion gap. So we made a start on that in 2003, Kirsty and I. Closing the compassion gap is what we wanted to do. So I thought what I'd do is see if I can capture that bit of history in a nice little baguette. So the early influencers. John Kabat-Zinn was probably the big one in the early days. He of mindfulness-based stress reduction and full catastrophe living. Nancy Klein, she of Time to Think and the Thinking Environment, who I know learnt lots from Harvey Jackins from Re-Evaluation Co-Counselling. And both of those extraordinary people were really thinking a lot about what are the conditions in which human beings do their best thinking. Prof. Paul Gilbert, who we're very lucky to have in our midst, writer of the seminal Compassionate Mind, Compassion Focused Therapy, Compassionate Mind Foundation. Oh my goodness, there's a typo. Sorry, Paul. It says Paul Gibbert. Well, I'm not going to change that now. If you ever see this video, please accept my apologies, Paul Gilbert. And I started to get very into Maya Angelou and extraordinary body of work, poetry, anti-oppression, race equality, gender equality, extraordinary author, activist, fierce, survived a huge amount in early childhood. Micheline Mason, I feel very fortunate to count as a dear friend. Micheline is one of the co-founders of the Parents for Inclusion, the Alliance for Inclusive Education, the writer of Incurably Human. Yeah, Micheline has embodied a life of one human at a time. Extraordinary. Beautiful poetry. Uppity Downs, probably my favourite. Coming towards the end of the baguette now. Probably about 5 or 6 years ago. Thich Nhat Hanh, Miracle of Mindfulness. Into Being, Plum Village, Walking the Path. When walking the path into the village, one should only be walking the path into the village. When washing the dishes, one should only be washing the dishes. And who's this? Tara Brach. Psychotherapist, Buddhist, extraordinary teacher around trauma, integration, compassion, so many more. Those are the influencers I wanted to refer to. So in the early days of the history of closing the compassion gap, let's see, the first thing we started to work on was the values. So yeah, early days, I'd say about 2005, these are the values that emerged. Thank you, Dr. Alistair Scott, for passing these first three on. Courage, humility, discipline. Compassion is an integration of courage and wisdom. Compassion humbles us time and time again. And a compassionate life is a disciplined life. If it was easy, we'd all be doing it already. Inclusion. Oh my God, there's so many typos. I'm tired. Illusion. These are hilarious. Paul Gibbert and illusion. Freudian slips. Micheline Mason. I have to thank for the inclusion justice. And Maya Angelou and justice. Just noticed in the work in the healthcare system, this sense of injustice and imbalance where the system was very focused on, well, defensiveness, defensive medicine, but also the needs of the patients rather than the needs of the system, which is driven by care workers, nurses, cleaners, porters, physiotherapists, doctors, consultants, anaesthetists, care workers. So it goes on. Lots of injustice and lots of exclusion. So in about 2010, halfway through the baguette, started to think a lot about habits. I read a book called The Power of Habit by Charles Duhigg, which had a big influence, and I got to thinking, well, if we were going to close the compassion gap, might there be some habits that would help us to create a more stable field of compassion? Lots of playing, distilling, testing, changing of language, trying things out in the room with ordinary people. These are the habits that surfaced. Listening, not just any old listening. Listening with a quiet mind. Listening to hear rather than listening to speak. Building on the listening. Listening to what? Listening to the answers to questions that matter. Asking questions that matter. For example, not what's wrong with you, what happened to you. And the third habit, appreciating from the heart. What I appreciate about you is speaking from the heart and listening with the heart. When we are listened to by somebody that's authentically curious, who then takes the trouble to appreciate us, we feel like we matter. And for those moments at least, the compassion gap closes. And when we receive these habits, of course, we have the same experience. More recently, thank you to Paul Johansson and the Kindful Way, a couple of other things have surfaced, some principles. So this is about 2000 and actually let's just take a breath there, because in about 2013, which I think is about here on the baguette timeline, had the absolute joy and privilege of working very closely with this man, Francis Briers, and together we designed this, a compassion circle, which is now being implemented in Wales. Thank you to Ben Waits and Charlie Jones and many colleagues, and is called this, Taking Care, Giving Care Rounds. And thank you to Claire Dalloway and colleagues in the Black Country. Some are now calling it this, Care Circles. So I became very conscious and curious about the power of circle work. Thank you to Professor Steve Onyet, bless him, he's no longer with us, who inspired and emboldened and enriched the narrative around the power of circle work in closing the compassion gap. So around that time, started to become more conscious of the need to, or the central importance of getting clear on what happens when we close the compassion gap, and these three things seem to emerge. These three linked realities. Trust builds, safety grows, and cooperation is inevitable when we create a more stable field of compassion. So, in about 2016, with the help of Paul Johansson of the Kindful Way, former head of patient experience for NHS England, Paul and I started to think a lot about some principles in what we were then calling the growth of relational intelligence. So this sustained baguette-shaped commitment to closing the compassion gap led us to the conclusion that what we were working was with a systemic shift from the transactional to the relational. So the growth of relational intelligence, and then what surfaced in one of our many road trips and walks in the woods was this idea of some principles, the first one of which is holding space. So how do we hold space for ourselves, each other, and the world around us? Beautiful work of Chris Germer, Kristen Neff, of which Paul Johansson is a senior teacher. Mindful self-compassion. Treating myself with self-kindness rather than self-judgment. Seeing myself as part of common humanity. Recognizing that just like me, people suffer. We all suffer. Which links to the third principle, being in community. So we hold space for ourselves and each other with the intention to grow self-kindness and collective kindness and compassion. And we do best when we're in community. I love what Meg Wheatley says. Whatever the question, the answer is community. So principles, values, habits. And in recent weeks, and it really is weeks, something extraordinary has taken place. So 2003 up to 2020, March 2020, COVID-19, just bear with me. The wonderful Charlie Jones, who's a senior psychologist at Southmead Hospital in Bristol, was reassigned. Charlie, it's no longer your job to care for all of the patients, it's now your job to care for all of the staff. Sat with Natalie and said, okay, well, how do we turn all this closing the compassion gap, compassion circle work to the advantage of those in the emergency zone? And this happened. Care space. Very simple acknowledgement that those who care need space, and that space needs to be caring. Very direct. Thank you to Charlie and Natalie. Beautiful work. And then about 2 weeks ago, the wonderful Laura Sims and Sonia Wallbank and Robin, colleagues at NHS, clinical team at NHS England, got to thinking there's something in this care space and these compassion circles, but these folks in the emergency zone are really, really under a huge amount of pressure, psychologically, clinically, sociologically, and they devised pause space. Care space takes 20 minutes. Compassion circle takes, closing the compassion gap takes 17 years and counting. Compassion circles take an hour. Care space takes 20 minutes. Pause space takes 10 minutes. If you really have only got a nibble of time, me space is just for you. Thank you, Laura. 5 minutes. So let's do what we can to close the compassion gap and join gentle forces with each other to make the world a kinder place. And it starts with each one of us.